We will be recognizing our local media partners later today for their assistance in helping to keep our residents informed as we have all lived through the pandemic for the last many months. Our goal today and our goal during this entire period has always been to keep our residents informed and be as transparent as possible about the steps we are taking to keep our community safe during this pandemic. The Florida Hospital Association is reporting over 16,700 people are currently hospitalized in the state of Florida. The Hospital Association also reports that this number is nearly 2/3 higher than the previous peak of hospitalizations in July of 2020. 36% of all patients in hospitals have the coronavirus. In addition, 55% of those in the ICUs, or intensive care units, have the disease. Just prior to this event, I was on a regional conference call with representatives from our largest hospitals in Lake, Orange, Osceola, and Seminole counties, and they all reported similar statistics here within our region. I have extended my executive order for another 7 days so Orange County remains in a state of emergency. This means that I will continue to urge our visitors and residents to wear masks when indoors, especially in crowded spaces, regardless of vaccination status. We want to continue to make sure that our businesses, residents, and guests follow the CDC guidelines so we can remain safe and open for business. It is still important that we pull together, get vaccinated, and mask up to get a handle on the surge that we are presently experiencing. There are now more than 192,000 coronavirus cases reported in Orange County. Dr. Pino will share more details with you about the specific numbers. But for the first time in quite a while now, our new cases are under 1,000 in one day. In fact, yesterday, 815 new cases were reported. That's still not a good number, but it is trending in the right direction. The number of deaths in Orange County now stands at 1,482, which is 8 more than we reported on Monday of this week. Sadly, I have to report that 2 additional Orange County employees died this week of COVID-related illnesses. So to those families, our hearts and prayers go out to our families here within the Orange County government, family of employees. So, where are we? Our 14-day positivity rate is not great. It is holding steady at a little over 20%. But many of our hospitals and the Department of Health is reporting that just maybe we have reached a plateau. The 14-day rate has been at 20% now for the past 12 days. As for the number of residents ages 12 and up who have at least 1 shot or more of the vaccine, it is currently at 65.53%. I'd really love to see that number move up faster. Since we opened the drive-through vaccination site at Camping World Stadium on August the 9th, nearly 1,300 people have taken advantage of the convenient location. As a reminder, there are no tests being performed at Camping World Stadium, only vaccination shots. If you are someone who needs a shot, Camping World offers the Pfizer vaccine. 3rd doses of COVID-19 or the booster shots are not currently available at Camping World Stadium. I will say that we are working with the Florida Department of Health in Orange County on our plan, and announcements will be made soon in our community when we will be offering 3rd shots or booster shots. Residents who are eligible to receive a booster may contact their nearest pharmacy location that is participating in the federal retail pharmacy program. In other words, our local pharmacies are already offering the booster shots. For a list of federal retail pharmacies in Orange County, you can get that information by going to our website at ocfl.net/vaccine sites. As for our 3 testing sites, a total of 4,083 coronavirus tests were performed in Orange County yesterday. That's nearly 4,100 tests in one day. Our hard-working Orange County Health Services team makes it all happen, so kudos to those nurses and other healthcare workers who are doing the yeoman's work to get people vaccinated. Barnett Park remains the busiest place to get a free test with 1,662 tests performed yesterday. The Econ Soccer Complex is not far behind. 1,579 tests were administered yesterday. And the former Claricona Elementary School in Apopka had 842 tests done yesterday. The testing sites, along with Camping World Stadium's vaccination site, operate 7 days a week between the hours of 9 a.m. and 5 p.m. Orange County's Emergency Rental Assistance Program continues to move forward, working well. We are approving additional applications for individuals who were adversely impacted by the pandemic. As of this morning, more than $7 million has been approved, which has helped to keep over 1,200 families in their homes. Tomorrow, our program staff will be at the Chickasaw branch of the Orange County Public Library between the hours of 10 a.m. and 1 p.m. to answer questions and help residents fill out their rental assistance applications. For more information, if you're looking for rental assistance, you can go to ocfl.net/rental assistance. Our I Got My Shot mobile trailer has been a great hit within our community. In many regards, the demand for the trailer exceeds the capacity. But tomorrow afternoon, between the hours of 4 p.m. and 7 p.m., it will be at Congregación Mita de Florida on West Lancaster Road. On Saturday morning, the vaccine trailer will be at Matthews Hope in Winter Garden, and also on Saturday morning, a second mobile unit will be at the Fresh Oil Ministries on Silver Star Road. On Saturday afternoon, the vaccine trailer will be at Astro Skate, which is located on South Goldenrod Road. And I want to applaud those businesses who have stepped up to require vaccinations and mask wearing in their establishments. I've heard from many business owners who have stepped up to the plate that their employees are getting vaccinated. Many are offering incentives. So thank you to those businesses who are helping us move the needle with the rate of vaccinations within our county. And now, Dr. Raul Pino will come forward and share additional details with you.
Good afternoon, everyone. Thank you, Mayor. As the Mayor mentioned to you, I'm going to quickly go through the numbers that he already reviewed for you. We have 192,504 total number of cases. Our 14-day rolling average is at 20.07%. It has remained at that level. And the number of deaths has risen to 1,462. In the last number that we are going to announce today, the total was not here, so it's 12, 15, 16. Okay. We have 16 additional deaths from 42 to 93 years old, 9 female, 7 male, 3 black, 12 white, 1 of other race, 4 ethnicity, 5 Hispanic, 5 non-Hispanic, 7 had underlying conditions, and 9 we don't know at this point if they had any. 1 of the deaths was from July, and the other 15 are from the month of August. 4 of the 16 deaths are on residential facilities, long-term care facilities. So here we are about to start experiencing the latest of the indicators of this pandemic that will come up, which I expressed to you 2 or 3 weeks ago, that this is when we are going to start seeing the numbers increasing, and they are. It's concerning also that 4 of these deaths are in long-term care facilities, and I really applaud the decision of the federal government to make it mandatory for employees of this facility to be vaccinated. In our trace investigation, most cases acquired in long-term care facilities has been in transmission from the care provider to the resident. And keep in mind that these residents are fragile, older, and with pre-existing condition, indoors, in a congregating setting. So it's critically important that we protect them, and Florida did a great job protecting these individuals and vaccinating very fast. Also, on the information, we started doing testing in the schools. We explained to you the rotation that we have done for the 7 different areas, subdivisions in the county that correspond to each of the members of the board. People are showing up, actually more numbers that we can handle, and that's why I want to appeal to the community that this is intended for the schools, for the students, and for the family of those students. And it's not open to the public at large. We have other settings, and this is a very small operation that is intended to facilitate for the parents who cannot otherwise bring the child during work hours to be tested, to have that ability at the schools where they go to. A lot of kids, a lot of family, a lot of sick people. Our positivity rate in the first day that we calculated, a handful of the data, that was Monday, was 16%. So it's very close to what we are seeing in general in the community. And we are using 2 methods. We are using rapid test for those who are ill so that they can have a result very quick. And this is where rapid tests perform best, is with people who have symptoms. And then using the PCR for those who just may have been exposed and wanted to know. There's a lot of conversation about the 3rd dose, the booster. And it's all available right now. Florida Shots was modified last night, or amended, to be able to accept this information. So we have the first numbers on that. And for those who are immunocompromised, has received transplant of solid organs, or have any debilitating disease that are qualified during the CDC guidelines, we advise that you talk to your provider. Most of these individuals do have a provider, and that's why they are in treatment. And explore with your provider if this is the right time for you. Just don't go to the site, just explore with your provider first. And remember that our major hospitals, all our hospitals, all CVS, all Walgreens, all many Walmarts are providing this 3rd dose. Yesterday, I'm going to pull the number here, about 300 shots for 3rd dose were reported, 394 were reported to the Department of Health, 1,175 were 2nd dosed, and 1,352 were 1st dose reported yesterday. Also, the mayor mentioned to you, as I mentioned earlier in the week and perhaps last week, we have seen a deceleration of the pandemic a little bit. And that's good news. And I think the communication with the community, increasing the max use, vaccinating all those individuals 2 weeks ago, is starting to give us results. So week 31, which is the week before last week, we saw an increase only of 8%. And you will say, wow, 8%, are you saying only? Well, the week before that, we had 31% increase. And the week before that, we have a 55% increase. And the week before that, we have a 67% increase. So you see there is a trend of the number of cases on week to week to start to decline a little bit. And last week, so far, because numbers change a little bit during the week, we have seen a decrease of 3%. But I think that probably will be raised, it will come close to 0, but it is important trend. and that we would like to highlight. Also, the number of deaths in this month has elevated to 39, and last month 55. Remember, last month was the first month that we have seen an increase since January of this year. There is a lot of interesting variants. Although we continue to report this number, you should assume that most of the cases that we are seeing are of the variant. But right now, reported to the state of the Delta variant, 1,221. But those are confirmed cases by genetic sequencing. So not every single test get that type of analysis. With regard to vaccinations, we continue to do well despite all the situation that we see with the pandemic. Let me just give you the numbers quickly by age group. With one or more dosed, from 12 to 17, we are at 50.7%. And that's good to be there, and we should continue to increase vaccination. I think it's a result of the rush before school started. The parents gave a priority to this, and it's working. 18 to 24, we are at 53%. 25 to 34, we are 51.4%. 35 to 44, 66%. 45 to 54, 72%. 55 to 64, 76%. And the best of all, 65 and plus, 81.8% of the residents in that age group have received at least one dose. We continue to do trace investigation and tracking with the schools. At the volumes that we have right now, we cannot assess every single case in the day that we receive the case due to the large volume and how complicated the process can be. So we are developing some strategies quickly to respond to these needs. Part of the strategy is to increase the number of employees at the health department that can receive compensation for working extra hours so that they can do this without interfering with our regular work, 8 to 5, that we have other responsibilities. We're also looking for the possibility of hiring as a part-time some of the employees of the Department of Education so that they can provide those services after hours, maybe from 3 to 7. And we have also requested additional resources from the state, and we have got some of those resources already. So we are quickly revamping to do this. But remember, trace investigation and tracking is not the panacea to this. The panacea to this is to get vaccinated if you qualify to be vaccinated. We also, as you may have heard, the governor was here on Monday, soft opening on Monday, the monoclonal site at the Camping World Stadium. That seems to be working very well. We are not directly involved, but we have heard that a lot of people are showing very sick, high percentage of unvaccinated people. And these treatments are adequate when they are provided at the right time to the right individual, but they are not a substitute to get vaccinated. These are treatments, these are not prevention, and the vaccine is the tool. The vaccine is the prevention. The vaccine is the tool that we didn't have in January and earlier in the pandemic that we have right now. So please get vaccinated. Thank you.
All right, thank you, Dr. Pino, for that wonderful update. Today, if there's any Spanish-speaking media with questions in Spanish, especially for me, we have Ms. Ilia Torres, who will come up and assist with translation. Dr. Pino is fluent. We also have Commissioner Gomez Cordero, who has joined us. We have Mr. Scott Howard from the Orange County Public Schools if there are questions related to the school district. And if we have other general questions, we have Director Danny Banks, our Public Safety Director, who is here as well. And with that, we'll open it up for any questions at this time.
Thank you, Mr. Mayor.
It's down there.
Steve Hudak from the Orlando Sentinel. Sorry, buddy. This is for Dr. Pino and for Scott Howard.
Scott, if you want to come forward.
So with the situation with the schools right now, and what tracing you've been able to do, have you been able to find whether it's school transmission or is it still community transmission? And what's the next step for us here?
So that's an interesting question, actually, because it's not that, we use a lot of the word schools, and it's not that the schools here are on another planet. They are next to your house. So, meaning it's the same community, it's the same people, just have to be in a different location. So, establishing transmission in the school, to be able to say that emphatically, although it's happening, you have to be sure that it's happening. There are humans there, and there are people with masks, people without masks, and traffic and moving, so it's happening. It's no doubt. How many, how much, we don't know. But it's an extension of the community. I'm saying, why not? Well, we don't know. Because if you have so many people out in the community, and you have a child who gets sick, and that child go to school, so every other single child around that child. So it's sometimes difficult. You can establish sometimes, because it's the only contact, and you can really, really delineate that. But we are making assumptions on the infection and where we was acquired based on the data that we have. But is a transmission happening in schools? Absolutely. Is happening because the school is special? No, they are part of the same community that we are. It's just another location. So the significance of the transmission happening in the schools is significant for the parents, of course, that they want to protect their child and the teachers. But from a public health point of view, it's the same transmission that happened out in the community in that sense.
I don't know that I have much to add. I think that, working with Dr. Pino and his staff to make sure that we are conducting contact tracing, we really need the help from our parents and our students to make sure that they're answering the call when the contact tracers call if they need to, make sure that, the teachers are all uploading their seating charts and rosters, and we're taking care of that. But the quicker we can turn that around and make sure that we're getting the quarantines letters issued from the Department of Health in Orange County, the better, and getting them home, and then making sure that they're there. So we're working as hard as we can, and obviously we're monitoring that at every site, and watching what's happening with the data, both on our dashboard and with the Florida Department of Health.
Okay, this is Melissa Thomas of Florida National News. This question is for Dr. Pino. Earlier, you briefly mentioned, obviously, the monoclonal antibody site that opened at Camping World. You mentioned there's a right circumstance and a right time for someone to be eligible. Can you kind of clarify, provide a few more details with that?
Yeah, I'm not in clinical practice, so I should not talk about that. I think that's for the providers who have the expertise on that field. But, what is important is for them to know that there is a time for treatment like any other treatment. If you catch it earlier, that's when the treatment are the most effective. But the interesting thing about the monoclonal treatment, not the treatment itself, the process is that this dichotomy that I cannot, and if someone can give me the explanation, I would love it. I cannot explain myself why some people will not take the vaccine but go for the monoclonal treatment. Not that I'm saying it shouldn't. The monoclonal treatments are great. That's not what I'm saying. But what I'm saying is an injection. It's not fully approved by the FDA, like the vaccine, very similar. It didn't have the extensive clinical trials that the vaccine had, but people are showing unvaccinated. And it is a great tool to have. It's one tool in the arsenal of treatment, and people should use it, and we should make it available. But the vaccine is there, and that will prevent you from having to have, for the most part, for a monoclonal treatment.
Dr. Pino, Lauren Seabrook, Channel 9. To go back to the schools for a minute, we've heard from some parents who are concerned that maybe some of the quarantine notifications were slightly delayed. I'm curious if that's an impact of not being able to handle all the contact tracing. And then my second part of that was the pediatricians that we interviewed last week were concerned about tomorrow and beyond, because that's kind of the 10-day mark. And they felt like that's when we would start to really see an increase. Are you thinking along those same lines?
So if transmission had happened in the schools, which, should happen, this is when we start seeing the increases. And today I was saying that we have seen a decrease in the number of cases, but we may see a shift in the age of cases as we see a decrease from older people taking the precautions that they need to take. Part of not getting to the trace on time is also that the emergency ruling give us now only 4 days, because at the 5th day, someone can have a test and go back to school if they are negative. And it's a very short time. And as Scott was mentioning, some people don't answer the phone. They see the health department, they don't pick up the call, or they are not home, the many variants that are. So 4 days is a very short time for this high number of cases for us to be able to do that. So that's why we are switching to a little bit after hours, after 5 o'clock with our employees, and using different strategies to see if we can get to people earlier than we are able to do right now. But, we have the sitting charts. We are in collaboration with the schools. It's working, but are we getting to everyone on time? No, not right now. Will we be able to? Yes, probably by next week.
Troy Campbell with Channel 6. This question is also for you, Dr. Pino. To clarify really quickly, did you say that the Florida Department of Health in Orange County is not a part of the Regeneron treatments that are being done at Camping World Stadium right now?
No, what I said was that we are not directly involved because it's handled through a contract with CDR McGuire because they have the capacity to do that. So it's to say the same that we are not directly involved with what Advent Health is doing or what Orange County is doing at Barnett Park. Now, that doesn't mean that we don't know what is happening. It's that we are not managing, we are not directing it, we are not providing the resources. It comes directly from emergency management at the state level.
Do you take that as a favor with resources, or do you feel cut out of the process since the Florida Department of Health is the governor's health agency? You're the top health official for that agency in this county.
No. I was informed prior to the opening. I've been informed of everything that is happening, what is supposed to happen. Actually, other counties are kind of a little bit jealous that we have it and they don't. So no, nothing of that. Is the fact that this is a multifaceted operation and not one single agency can do everything at the same time.
Donaldo González, Telenoticias 31. I have 2 questions in Spanish because I've been answering in English already. It's about the treatment, monoclonal treatment, to explain a little bit because people are confused with 1 vaccine, 2 vaccines, 3 vaccines, and now another thing. And also the state of emergency, what does it mean? Maybe somebody can answer that in Spanish, or Ilya, please.
Yeah, as Ilya moved to answer the question on emergency management, with regard, en español, con respecto a los tratamientos monoclonales o tratamientos inmunológicos, la intención del tratamiento es proveer a una persona que ha sido recientemente infectada o que piensa que fue expuesta para proveer una respuesta inmunológica elevada. No sustituye a la vacuna, no sustituye a nada y no es un tratamiento que si usted está severamente enfermo con el COVID-19, falta de aire, debilidad, usted debe ir al hospital, debe ir al cuerpo de guardia, especialmente si tiene falta de aire. Es importante que la gente sepa que estos sitios están destinados a ofrecer esta alternativa, pero no es la solución, es una alternativa. La solución es la vacuna. La tercera dosis que me preguntaste, inicialmente la intención es proveerla a esas personas, de nuevo, que tienen compromisos inmunológicos, ya sea porque tienen HIV y no están bien tratados, ya sea porque tienen tratamientos autoinmunes para el cáncer, o que han tenido trasplante y tienen que tomar medicación para prevenir la rejection, no me acuerdo ahora la palabra, del órgano por el cuerpo humano. Esas son las intenciones. Pero la tercera dosis en estos momentos está destinada solamente para esas personas. En septiembre, la tercera dosis va a estar disponible para un mayor grupo de personas que son mayores de 65 años. En estos momentos pensamos que las personas que tienen necesidad de la tercera dosis deben consultar a su proveedor médico. La mayoría de las personas que están en esta categoría tienen un medical home y deberían llamar a su doctor de estar seguro que ellos están en las condiciones adecuadas para recibir la tercera dosis. Y se está ofreciendo en todos los lugares. Todas las farmacias las están ofreciendo también la está ofreciendo a nuestros hospitales. No se necesita ninguna documentación, solamente atestar de que tú tienes una de esas condiciones. Pero de nuevo, mi consejo personal es consulta con tu médico antes de ir a ponerte la tercera.
En vez de tomar la tercera dosis, tomar el tratamiento monoclonal. Eso no es algo.
No, estas dos cosas son dos cosas diferentes. And I will answer that in English too. Is you were asking if the monoclonal is a substitute for the third dose. No, the monoclonal is not a substitute for the vaccine. The monoclonal is not substitute for the vaccine. The vaccines are the treatment. En español, los tratamientos monoclonales no son un sustituto para la vacuna. Los tratamientos monoclonales están destinados a personas que han sido expuestas o que están infectadas para proveerle un poquito extra de inmunidad para que puedan pelear la enfermedad mejor. Pero la manera de generar tus propias defensas es usando la vacuna.
En el estado de emergencia, ¿qué significa el estado de emergencia, por favor, en español?
What's the significance or the meaning of being under a state of emergency?
As the mayor of Orange County, I have the authority to issue a state of emergency, and in this public health crisis, it is primarily related to the fact that we still have a high rate of transmission of the disease within our community. I'll stop.
Como alcalde del condado de Orange, tengo la autoridad de declarar un estado de emergencia y en este caso se debe al alto nivel de transmisión del virus.
What that does is allow us to marshal the resources of our community across all county departments and divisions, and also work with our community partners to respond to the current situation in a timely manner with appropriate resources.
Lo que este estado de emergencia nos permite es activar nuestros recursos entre nuestras divisiones y departamentos, así como trabajar con nuestros socios comunitarios para activar y poner los recursos a disposición de la comunidad.
This question is for Dr. Pino. So, having trouble keeping up with the quarantine notifications in the schools, what is the lag time between, say, a student testing positive in a classroom and the kids actually being notified? And is that potentially furthering the spread if there is a delay?
So the second question first. And Lauren always asks me why you answer the second question first. I don't know. But maybe the strategy to try to skip the hardest. But yes, the short answer to if we don't get to someone on time, will that increase the possibility of? So, two things first. So we are talking about quarantine, which means we suspect that the person was exposed, and that we suspect that exposure was such that it could be infected. So we are placing the person away from the community for a period of time until give it the opportunity to see if it develops or not develop the disease. That's a quarantine. So it's less risky in that sense. What is critical is isolation, the individuals that are positive, because we know for sure that they can transmit the disease. So with regard to quarantines, yes, we are not being able right now to get to everyone. Does increase the risk of transmission happening? Possibly, if that person was infected. So it's a short answer with a long explanation. Now, what was the first part? The lag time. I don't know the lag time. Because it could be different for every school. It could be different for every child. It could be that some person who we got the test today answered the phone right away, and we get it right away, and we have been trying someone that we have the wrong number, the wrong email, or it's not picking up. So it's difficult to say that.
I think Scott wanted to add.
As far as contact, let me take this on. As far as contacting our parents, as soon as a case is confirmed, either by the principal through a medical documentation or a lab location, they're notifying the class that there's a potential close contact, and then they're notifying the entire school of any cases that happen throughout the day. He then, or the reverse could happen. If the Florida Department of Health in Orange County notifies a principal that there's a confirmed positive that he wasn't aware of, as soon as he knows, he's going to let that class, that club, that sport know. So we're communicating immediately with the families. They may not get the official quarantine notice, but we're letting families know that we were aware of a positive case and that student's in isolation. So we're taking care of that, and then we're also notifying them of the quarantine letters when they go out, that they're going out to their emails once we receive them, and then we're letting them know when they've all gone out. So that way they know whether their child's been quarantined or not.
Let me add something there also. Something that is taking a lot of our time is releasing people from quarantine, because the parents send an email to us with a document saying, here, my child was tested, it's negative on the 5th day, and then we have to go through every single email, verify that that test did happen if we have the results and that the results are adequate, and then release the person from the quarantine list. That is taking a lot of our time, and that wasn't there before. We were not doing that before. So just for information for the public, it's 200,000 kids in the school system. It's more than that, but about 200,000. So that generates a lot.
Doctor Raúl Pino, Víctor Berrío, Noticias Univisión Orlando. ¿Me puede dar el reporte relacionado con las hospitalizaciones pediátricas?
Yo no tengo ese número. No tengo acceso al número exactamente. Pero creo que son más de 10 en el condado.
Una última pregunta. Mi nombre es Ángel de Univisión Orlando igual. ¿Cuál es el % de las familias hispanas respondiendo a irse a vacunar? ¿Y cuál es el mensaje que le lleva entonces la oficina del alcalde a la familia hispana que se rehúsa a hacerlo?
Mira, la realidad es que, y yo lo he expresado antes, hay cierto temor en nuestra comunidad latina a vacunarse. No todo el mundo. Y la gente tiene que también entender que nuestra comunidad latina es muy diversa. Venimos gente de muchos países con mucha cultura y muchas experiencias con sistemas de salud que afectan nuestra confianza con esos sistemas de salud. Y la otra parte que se añade a la cosa latina, a la experiencia latina, es el hecho de que muchos de nuestros hermanos están de manera indocumentada. Y eso genera un tipo de preocupación en ellos de que se sepa quiénes son, dónde están, qué hacen, qué número de teléfono tienen. Y ven que incluso con nosotros asegurarle a cada uno de nuestra gente que esa información no se comparte con el gobierno. Como somos parte del gobierno, pero esa información está protegida completamente porque está protegida por HIPAA y no la compartimos con nadie. He asked me in English if I have a special message for the community, Latino community, and what percentage of our Latino community was not getting vaccinated. And I was expressing that it's a significant percent. Now, part of the issue with the community, with Latino community, is that we really don't know the true side of it, because there are an element of people who are undocumented, and you don't know. We always can calculate. And part of the community Latino issue is also that it's a very diverse community. And it's not one country, it's not one place, it's not one culture. We do share a lot of roots and common elements of our culture, but experience of each country is a little bit different. The experience with the government or dictatorship, or whatever may have happened, also influence the trust that they have with the government. And that adds to that. And the fact that we have an element, a size of our community that could be significant here, that is undocumented, adds to the fact that they want to remain hidden and not be seen, even after sharing within the information and the level of security that we have with our data, because all our information is HIPAA protected and we do not share with any other agency in the government.
Radio Haiti Tropical. My question is, does the county or the school district provide some kind of assistance for parents whose kids are in quarantine? I'm talking about working parents. So is there any kind of assistance for those parents who are going to have to stay home if the kids is like 12 or under 12?
So as far as their schoolwork, are you talking about and helping them with that?
Yes, is the county or the school district provide any kind of assistance for parents whose kids go to school and they are in quarantine and the parents are working? Now they have to stay home and they got trouble with the work. So is there any kind of assistance that the county or the school district can provide?
Well, as far as when a student goes into quarantine, their teachers are providing their work either on the digital platform, or they're providing paper packets for the students to keep up with their work at home. As far as other options out of quarantine, I mean, quarantine implies, I would assume, Dr. Pino, that you're at home in quarantine. And as far as providing an alternative to that, no. But as far as providing the work for our students, we're doing that. We're treating it as though it's an illness or they're sick, and as long as they're able to work from home, we're even providing teachers the option, if they want to allow students to listen into their class and to pick up the lessons as they go, so they can get a little extra enrichment that way. So we're offering those online and resource tools for our students when they are at home and in quarantine or isolation.
This next question was texted in from Abe with WMFE for Dr. Pino. His question reads, can you ask the health department representative what the adult ECMO capacity is in Central Florida? Do centers have enough staff equipment to accept new ECMO patients?
What kind of patient?
Extracorporeal membrane oxygenation,
Oh.
artificial heart/lungs.
Okay. I don't know. I don't know the answer to that question, Habibi.
From Bob Hazen from WESH. Dr. Pino, we have heard from people about extremely long wait times at hospital ERs. How big is the problem in the county, and is anything being done to open up more space or reduce wait times for patients?
That's a question for the hospital system at ACA.
And lastly, from Ryan Lynch in the Orlando Business Journal for Dr. Pino, what indicators will point toward a full stop of the latest spike versus a temporary dip?
We have seen a decrease of the ER visits. That's always the first data that goes in the right direction. Then you start seeing a decrease in the number of cases. Although I want to alert people that a couple of days don't make a trend. It just can be a blip. So we are cautiously optimistic that things are maybe stabilizing at this level. Although the number of cases reduced yesterday and a little bit the day before from the prior day, the positive rate continued to be the same. And those are the dynamics of this data that you have to always be juggling around to try to read the tea leaf of what is happening really. The other piece is that hospitals are also reporting a stabilization of the number of people that are getting admitted. But the numbers continue to be very high, and in some cases, ICUs are not available, ICU beds, and in some cases, people are waiting for one to get empty to put the other person in. And that creates dynamics for the hospital, as you mentioned. In some cases, I think Dr. Shu was saying today, 40% of their cases in the entire system are COVID-19 cases. So that means that it's less bed to take care of a heart attack, an accident, an appendicitis, anything that the health system normally process daily have to be put aside. There are individuals waiting for cancer surgery that is growing there. So the dynamics of these are not just limited to COVID-19 or to unvaccinated individuals or to breakthrough cases, it has a ripple effect through society. Because the gentleman from Radio Haiti was also saying, okay, well, how about a parent who have to go and take care of a child and cannot work any longer? How they are going to provide? So the ripple effects on mental health in the long term. So to our healthcare workers who are experiencing these, and they have become the parent, the mother, holding the hand, listening to the last confession, and doing everything else that otherwise they will not be doing in these conditions that we are presently. So it is affecting entire society. That's why it's so important for everyone, not just to get vaccinated for your own protection, but the protection of all of us as a community.
Okay, thank you all for being here. This concludes the press briefing for today. The next press briefing will be on Monday, the 23rd, I believe it is, at 11 a.m. Also, if you all will join us in the chambers, we will be making presentations to the station managers or their representatives for the partnership that we have enjoyed for so long now, as we have kept our community informed about the progress that we're making. So with that, Commissioner Gomez Cordero, if you're able to join us in for the photo opportunities in just a few moments. Again, thank you all for being here.
Check, check, check.